There are two main arteries that supply the face, the facial artery and the superficial temporal artery. The facial artery is a branch of the external carotid that actually originates in the neck. The facial artery branches off the external carotid, runs upward across the upper part of the neck, crosses the mandible just in front of the masseter muscle, and then continues its pathway across the face and finally up to about the medial canthus of the eye. Along its course, the facial artery will give rise to inferior and superior labial arteries running into the inferior and superior lips, respectively, a small lateral nasal artery, which runs over to the external nose, and finally, an angular artery, which is the terminal part of the facial artery. And the angular artery runs up again into the small angle between the medial canthus of the eye and the side of the nose. The superficial temporal artery is one of the two terminal branches of the external carotid, the other one being the maxillary artery, which runs deep and forward across the deep aspect of the face into the infratemporal fossa. The superficial temporal artery usually gives rise to a small transverse facial artery, and the transverse facial we typically will find located just above the parotid duct and just below the zygomatic arch. The superficial temporal continues up the side of the face in front of the ear and will eventually give rise to two main terminal parts, an anterior or frontal branch and a posterior or temporal branch. Facial and superficial temporal arteries also have small supplemental vessels that supply the face running along with them, where we find the supratrochlear, supraorbital, infraorbital, and mental nerves, which are branches of the trigeminal nerve. Those nerve branches are also accompanied by small arteries running in parallel with the nerve branches. This diagram gives you a very basic diagrammatic representation of the main arterial supply to the face and shows you the vessels that were described in the previous diagram. This illustration gives you a second, somewhat more artistic view of the main arterial supply into the face. Let's concentrate on three main features. First thing to notice here that the facial artery originates from the external carotid in the neck. As the facial artery moves up out of the neck and into the face, it crosses the lower margin of the mandible just in front of the masseter muscle. If you clench your jaw, you can typically feel the anterior boundary of the masseter muscle pretty distinctly. Try to feel right up against the mandible, right at that lower anterior inferior edge of the masseter against the mandible, and you can quite likely feel the pulse of the facial artery where it lies against the mandible as it enters the face. This is a really nice place clinically to be able to pick up the pulse of the facial artery, which can be significant when looking at certain disorders within the facial region. Again, that first thing we wanted to notice here was that location of the facial artery where it crosses the mandible, right at the anterior lower edge of the masseter muscle. Another thing we want to notice about the facial artery is that it crosses the face very close to the corner of the mouth. The corner of the mouth is the angle of the mouth, is subject to stretching and torsion when you open your mouth widely. And the wider you open your mouth, the wider your gape, the more stretch is applied to the facial artery. And this could potentially affect blood flow through the facial artery. The facial artery typically ascends the face in a very wiggly, curlicue fashion. What we find here is that the facial artery has these built-in pleat-like folds within it, which allow the vessel to be stretched when the mouth is widely opened. And when the vessel is stretched, then it has this built-in extra length allowance so that the vessel does not get stretched out as dramatically as it might otherwise be. And blood flow through the artery is not typically affected much at all by wide gape. The facial vein, which lies more posterior to the mouth, is not subject to the same mechanical forces in stretching as the facial artery. And so if you look at the path of the facial vein, you'll see that that vessel typically takes a nice straight course across the face. But again, the facial artery, being closer to the angle of the mouth, has characteristic wiggly or curlicue type appearance as it ascends across the face. The third thing we want to notice in our arterial look at the face is at the upper end of the vascular flow at the medial corner of the eye. Notice here that the facial artery is shown coming up across the side of the face, and it ends as a small angular artery near the medial corner of the orbit. The ophthalmic artery, which is derived from the internal carotid, comes across the orbit and supplies structures within the orbit, and ultimately ends by giving rise to small supraorbital and supratrochlear vessels which ascend up across the forehead. The superficial temporal artery has given rise to both anterior and posterior branches. On this diagram, the ABST you see is the anterior branch of the superficial temporal. Notice how that anterior branch of the superficial temporal typically sends a long curving branch all the way across the side of the head into the forehead, and that anterior branch very commonly will form an anastomotic connection with the ends of the ophthalmic artery coming out of the orbit and with the angular artery as it comes up at the medial corner of the eye. So we have here a notable ophthalmic arterial anastomosis between the angular artery, the end of the facial, the ophthalmic artery coming out of the orbit, and the anterior branch of the superficial temporal coming forward across the side of the head. Arterial supply to the scalp is a very extensive but freely anastomosing network that typically follows the cutaneous nerves that we described earlier. We want to recognize that in this arterial network there are two main groups of vessels. The first group is composed of branches of the ophthalmic artery, and these are the supratrochlear and supraorbital arteries that are, again, terminal continuations of the ophthalmic artery as that comes out of the orbit and up across the anterior forehead region. The other and larger group of arteries to the scalp are all branches of the external carotid artery. The posterior auricular and occipital arteries are branches off the external carotid which come up across the more posterior aspect of the scalp. The superficial temporal artery is one of the two terminal branches of the external carotid. That comes up across the temple, across the side of the head in front of the external ear, and finally terminates as anterior and posterior branches which spread across the sides of the scalp. This diagram gives you a simple diagrammatic breakdown of the main venous drainage pattern of the scalp and the face. Venous drainage, for the most part, basically parallels the arterial supply into the face and scalp. Ultimately, the larger part of that venous drainage is mostly into the jugular system, into both the internal and external jugular veins. Here we have 5 groups of veins, or 5 parts to this branching pattern, laid out as A, B, C, D, and E groups. The group A veins show you here on the diagram that the supraorbital and supratrochlear veins typically drain downward out of the forehead and join into the angular vein. The angular vein forms at the medial canthus of the eye and continues downward, draining along into the facial vein pathway. Group B is showing you that the supratemporal vein joins with the maxillary vein, and this junction forms a significant retromandibular vein in that tight space between the ramus of the mandible and the external ear. The retromandibular vein drains further downward and then divides into a posterior branch and an anterior branch. Group C is showing you that the posterior auricular vein, draining down behind the external ear, drains into the posterior branch of the retromandibular vein, and this junction forms the external jugular vein, which continues to drain downward along the side of the neck. Group D is showing you that the anterior branch of the retromandibular vein drains into the facial vein, and that facial vein then continues downward and drains into the internal jugular vein. Group E deals with the posterior aspect of the scalp. In this case, the occipital vein drains down out of the posterior aspect of the scalp, pierces the trapezius muscle, and then drains into a suboccipital venous plexus network, which is located in the suboccipital triangle. That suboccipital plexus then will drain into the vertebral veins and continue downward through the neck. Let's concentrate on just a couple of features in this diagram. Notice that right in the center of the head, this illustration shows you the location of the cavernous sinus. And remember that the cavernous sinus is located on each side of the sella turcica within the cranial cavity. If we go forward from the cavernous sinus, you'll notice on the diagram that there are both superior and inferior ophthalmic veins illustrated, and those ophthalmic veins drain structures in the orbit and drain them backward into the cranial cavity and drain into the cavernous sinus, again at the base of the midbrain. Now, in terms of the face, further to the right on the diagram, remember that the supraorbital and supratrochlear veins drain downward out of the forehead and communicate with the angular vein, which is the beginning of the facial vein. And under typical flow conditions, the supraorbital and supratrochlear veins drain downward into the angular, blood continues downward through the facial vein, and eventually into the internal jugular vein. In this case, what we want to add to our concept picture here, very importantly, is that the supraorbital, supratrochlear, and angular veins all additionally have distinct communications normally with the superior ophthalmic vein. So therefore, under certain conditions of venous flow, blood can backflow through those vessels into the superior ophthalmic vein and back all the way into the cavernous sinus, and potentially back further from the cavernous sinus up into veins located around the base of the brain and which drain the base of the brain. So we have an important area in the face called the danger triangle of the face. And as the name indicates, this is a roughly triangular area. If you think about a base of this triangle across the upper lip with the two ascending sides of the triangle running upward and closing the area of the external nose and running up into the forehead, this danger triangle is an area which typically receives drainage from the supraorbital, supratrochlear, and angular veins leading down into the facial. And in this danger triangle, blood can potentially flow again backward through this ophthalmic venous anastomosis into the superior ophthalmic vein and back into the cavernous sinus. The parotid is the largest of the salivary glands and is enclosed by a dense fibrous capsule. This capsule is noteworthy because it tightly constrains the size and extent of the gland itself. Diseases within the gland, something that might occupy more space, such as a cancerous tumor within the gland, as that tumor expands, puts great pressure on the parotid gland and on the structures contained within the gland, other structures that are passing through the gland. So there is no room for the gland to expand much under contained pressure, and as a result, the parotid can elicit a great deal of pain and discomfort when there are structures expanding within it. The parotid has one large parotid duct that drains it. This duct emerges from the anterior part of the gland and runs forward across the superficial surface of the masseter muscle. If you lay your index finger across the cheek with one side of it at the zygomatic arch, the parotid duct is typically located about 1 finger breadth inferior to the zygomatic arch. As the duct reaches the anterior edge of the masseter, it takes a deep dive at the front end edge of the masseter, penetrates the buccinator muscle, and finally drains into the mouth, opposite the upper second molar tooth. And if you probe with your tongue along the lining of your cheek, opposite the second upper molar tooth, you can oftentimes feel a little nodule or a little irregularity in the lining of the cheek, and that is the opening of the parotid duct at that point. Now, as we just said, the parotid is enclosed by a very dense connective tissue capsule, which very much constrains the volume of the gland itself. There are a series of critical structures that pass through the substance of the parotid gland on their way to distributing to wherever they're going. If the parotid gland were to be expanded because of growth within the gland, such as, let's say, tumor formation within the gland, the inability of the gland to expand to any notable degree can apply significant pressure on these structures that pass through the gland and can cause very strong detrimental effects to those passing structures. Likewise, if it's necessary to run a surgical procedure into the substance of the parotid gland to, for example, remove some tumor growth within the gland, it's also critically important to understand the routes and the natures of the structures that are contained within the gland, because now surgical work in that gland can certainly immediately endanger the structures which pass through the gland and are compressed and tightly contained within the gland. So we have to be very aware of structures that are contained within the substance of the parotid gland. There are typically some parotid lymph nodes in the gland, but these are highly variable in terms of number and exact placement within the gland. Remember that the facial nerve emerges from the base of the skull through the stylomastoid foramen and curls upward into the substance of the parotid gland. The network of structures indicated in yellow represent the facial nerve coming into the parotid gland and then dividing into its 5 terminal facial branches, which distribute out of the substance of the gland. So the facial nerve is a very important structure that we find contained within the substance of the parotid gland. Also, in terms of venous drainage of the facial region, we find that the retromandibular vein passes through the substance of the parotid gland. Shown in blue on the diagram, you can see the superficial temporal vein draining downward from above. You can see in blue the maxillary vein coming in blue next to the maxillary artery, which is shown in red. Those two vessels join together to form the retromandibular vein. And then at the lower aspect of the parotid gland, or just outside the parotid, the retromandibular vein will divide into its anterior and posterior branches or division. The external carotid artery ascends along the side of the neck and up into the face and enters the substance of the parotid gland, and within the gland will divide into its terminal branches, which are the maxillary artery running forward and deeply into the infratemporal fossa, and the superficial temporal artery, which ascends along the side of the head. So we find the termination of the external carotid and the formation of the superficial temporal and maxillary arteries all being contained within the parotid gland. Also, another nerve, which is the auriculotemporal nerve, is a branch of the mandibular division of the trigeminal, and that originates deep in the side of the head and wings upward through the parotid gland and accompanies the path of the superficial temporal artery up along the side of the temple and up onto the side of the head. So we have a network of structures contained within the parotid gland, and you want to be very aware of those structures, and you want to be thinking about structures in the face that are contained within the parotid versus structures which might be related to the parotid gland which are not contained within it and would not be affected directly by disease of the parotid gland.